Hi everyone, it's Doreen Armstrong-Ross, President and CEO of the Dryden Regional Health Center, here today with the COVID-19 update for the Dryden area. As you likely know, we did have another positive in the area a couple weeks ago. All cases in Dryden are now considered resolved at this time. There is some new provincial direction around testing, and testing is still being done out of our assessment center here on the hospital grounds. We are asking that people do make appointments either by phone or by email. We'll attach that information in the comments of the video. But the direction of the province is to have testing available for people even if they don't have symptoms. So if you are somebody who is concerned about possible contact with COVID-19, or that you are in a working area where you do come in contact with people, that you do get tested. You do not need a referral. You can just call the assessment center or email and get an appointment to come and get tested. We are also been working on our reopening of our various services or upping. We hadn't really closed any services, but we were, just because of the Directive 2 from the province, limiting those to essential services only. But we have had an internal committee working with the guidelines that had been put out by the province and with Ontario Health to develop a plan for opening. So our plan is developed and will be implemented in the next couple of weeks. There is quite an extensive sign-off process for our plan that it's going through right now. What this means is there'll be a very gradual reintroduction of services that were considered, that we weren't doing in the non-essential time periods. So services such as increased diagnostic imaging testing, different procedures in the OR, more access to our rehab services in-house. Along with that, we do still need to maintain physical distancing in the organization. So you'll probably see a lot of changes in where you're expected to wait and how appointments will be booked, because we are certainly maintaining the safety and security of our patients and our staff during our reopening time. It's going to be a very gradual, slow reintroduction of all our services. And at the same time, we need to keep them nimble enough that if there is COVID activity, we can ramp back down and keep everybody safe and cared for. So you may be getting calls for an appointment if you've had a referral in or you've been waiting, and you'll be hearing from whatever department you may have been interacting with over the course of really the next few months as we get caught up in anything at this, and maintaining our ability to care for any COVID patients that may come in. We've started with a few changes to our visiting. We've changed our palliative care visiting. We know that it's heart-wrenching to not have visitors in at the end of life, and with the minimal activity of COVID at this time, we did feel comfortable with opening up visiting for palliative patients a little bit more than it was. It's still restrictive, but definitely we are opening up that a little bit more. We will continue to look at other visiting, and as our recovery plan plays along, you'll see different restrictions around that and people coming into the organization. At this time, we still do not allow any other non-essential escorts or visitors in the building with any patients coming in. We are also asking that everybody wear a mask when they come to the organization, whether it's a homemade cloth mask is completely acceptable, or there's different masks around town, procedure masks, that sort of thing that you can purchase. That is fine. Of course, if you come here and you don't have a mask, we will provide you with one, but the expectation is that people are masked and are wearing them around the organization. You will see that the staff are all wearing masks, unless they can ensure a physical distance. Like, for example, if they're somebody that works in an office setting, they can have their masks off then, but otherwise we're expecting that all staff are masked at all times as well. That's really the extent of my update today, and I'm hoping everybody's keeping well. I do hope that you are wearing masks in the community to keep yourself safe and other people safe. And as we work to get through this pandemic, it's important that we all work together and do our part. And masking as well as hand hygiene are key components of that at this time. So thank you for doing your part, and we will be here for you when you need us at the hospital. Thank you.